Okay, so I'm here with Sean Riley, and he's the Director of Physical Therapy, Occupational Therapy, and Speech Therapy at NEA Hospital. So why did you choose this profession?
Oh, I chose it so long ago that I barely remember because I've been in it for a long time. Actually, I do remember. I played high school football a long time ago. It's still popular today, but this was back in the 80s that I went to high school. And I had several friends that played, and one of my buddies, actually one of my best friends, still my best friend to this day, tore his ACL when we were in our senior year during a game. And he would had his surgery, and then he'd go for rehab, and we were really interested in what they were doing with his therapy. And along about that time, a representative of the University of Central Arkansas came to our school and talked to us all. All the seniors got to go listen to him, and she was giving her spiel about the University of Central Arkansas, and I remember it was one of the last things she said, and she said, "And we're the only physical therapy program in the state." And at that time, they were the only program in the state. And so that day, me and my buddy that tore his ACL and another friend of ours were like, "That's it, we're going to UCA and we're going to be PTs." And sometimes you say those things and they don't happen, but two of the three of us, that's what we do today. Still, we both went to UCA and became PTs. That's the rest is history.
So how long have you been in this field?
I graduated from UCA in December of 1994. So if we're in December of 2015, we're looking right at like 20 years. That's a long time. It's a long time. Really 21 years really where we're at right now. So longer than you guys have been on Earth. No, but you're not 21, are you?
No.
You're not 21, are you, camera person? No. That's Lauren back there. She's the camera person.
Hi.
So
I know you said you're more of an office kind of now, but how are your days usually as a PT? How do they start and end?
And it depends so much on the type of therapy that the person does. But in my days of clinical practice, it was just straight go patient care. So our therapists here in the hospital, they get here in the morning, and everything's now computerized in the hospital. So all our patients populate on our screen when we log in. All of our new patients populate overnight. Our patients that have discharged fall off. So we have therapists that look at our staffing, look at our new patients, and they distribute those electronically to all the staff members. So that when the staff member gets here and logs into the computer, their assignment's already on their screen. They can start to review the patient's history if they don't know them. They can look at the patients that they know for a quick update, and then they're straight out on the floor seeing those patients. In the hospital setting, that's a very busy place to be because the patients aren't necessarily in the hospital for physical therapy. They're in the hospital to recover from disease or trauma or any of those things. And there's several things that are, say more important, but kind of take precedence in the acute care setting, such as they may have testing that they have to do. They may have a surgical procedure that has to be done that day. And we have to work around all those things, plus the other disciplines in the hospital, respiratory therapy, trying to get to the patient, lab, trying to get to draw blood. And so it kind of makes for a hectic day for our therapists, but they hit the floor running and get all their work done, all their patients cared for.
Wow, so that's crazy. I've always wanted to work with elderly, specialize more in that. Is it possible to specialize as a physical therapist and just work with elderly, or do you kind of have to be with everybody all
That's
the time?
a great question, and the answer to it is yes, you can work with whatever population that you want. And in addition to you just choosing to work in an area that you want, you can gain a clinical specialty that adds letters to your name. When you're going to be Allison, last name, PT, ... You can start adding things to the end of them. There's sports specialties, geriatric specialties, hand therapists, different things that you can get clinical specialists that are completely after college, completely after graduate program that you do continuing education. You pass more tests for that. So you can get a specialty in geriatrics, and then you can choose to work in that area too. Most people do choose to work in a specific area. There aren't a lot of people that work in the peds one day and then geriatrics the next day. So that's your OT coming for the next interview. But if that's what you want, you can definitely get that for sure.
So what was your major before physical therapy?
When I went to school, you didn't have to complete your degree before you got into the program. You completed your bachelor's degree somewhere around the first year of the program. So it wasn't me being an old therapist that's been out for 20 years, I know now that you have to complete a certain type of degree. And that, I know, is anywhere from exercise science to biology that they're getting right there. My bachelor's degree was in something called applied health science, which is a degree they basically created your bachelor's degree so that you could go into the graduate portion of PT program at UCA when I went.
Oh, okay.
But pretty much the most popular two now, I think, are exercise science or kinesiology or biology.
Okay. What advice would you give someone pursuing this profession?
I guess I would say pursue it for the right reasons. Don't look at just statistics and say, hey, there's a good job market for this career, or hey, it looks like these people make decent money, because it's a lot harder job than that. Mm-hmm. And going back to what I said, I graduated in December of 1994, and that same exact thing is going to happen to both of you guys, whether you believe it or not. 20 years is going to go by like this, but when you really think about it, you're doing that career for that long. You're doing the career longer than you've been alive. So if it's something that you just have picked out of a folder or picked out of thin air and you really don't like it, then life's not going to be very good for you. When I talk to kids about the profession, I'll always ask them, I was like, think about the teachers that you've had in high school, and I was like, any of you have a teacher that you could tell didn't like being a teacher? Every time the kids raise their hand, I was like, but conversely, not to badmouth teachers, do you know of a teacher that got up every day excited that they were a teacher, that worried about you guys on how you were going to do on your test, that tried to become a better teacher, that tried new things to get across the information? They would all raise their hands too, and I'm saying, I don't care what you be, but I want you to be that teacher. And that's kind of the tough thing for you. If you're already thinking that you like the elderly and you like to work with it, so you're already a step ahead of just picking an occupation, which is good.
I know it's very competitive to get into the physical therapy program at anywhere, but at Arkansas State, I know for sure that it is. And we're going to have to be applying soon for school. Do you have any advice when it comes to the application process? Any other job experience I could get or anything like that could help put me ahead of the game for?
Yes, here's the advice. I'm not sure if this is what you're asking for, but this is the truth, that everybody in every field is held accountable for certain things. In the world of physical therapy, we're starting to be held accountable by insurance companies for the outcomes, what we do with our patients. And you can no longer just take a patient and say, well, we worked with them and we did our best. You have to show that we made progress. Every field in every type of setting is the same way. So if we go back to university that is a program of physical therapy, they're held to certain standards too. And some of the standards that they're held to is how people pass their licensure exam after school. They want every student that they accept to pass the licensure exam. They want every student that they accept to pass their licensure exam on the first try, if at all possible. That makes them look good, it helps them market, it shows it's a good quality metric for their program. So that's what every university is looking at kind of right now. And I can tell you that it used to be that they would just look at simply grade point average, but right now I know they're looking at your grade point average with the classes that you took. For example, if you make a B in a class, like let's say, if you ever heard of biochemistry, if you make a B in biochemistry, that's better than an A in a class that's just super easy, that everybody knows is super easy. They know that. So it used to be really strict on just the highest grade point average and these kind of things. It's not anymore. Because a 4.0, this 4.0 may not have taken any of the same classes this 3.6, this 3.7, that's taken all the chemistries and all those things. So I guess I say all that to say this. You really need to challenge yourself with some of your prerequisites, and you need to buckle down on those classes that you know are harder. Because if you can pull out an A in biochem, if you can pull out a B in biochem, it's going to look good for you. All A's in the easy classes, they look at that because they've done the research and they're saying we've let some 4.0s come in here that couldn't pass their test, that didn't do well in our program. And so now I'll say all this. When you get out of school and you pass your test, as a director I've hired more therapists than I can count or even remember, I never, ever, ever do I care what somebody's grades are in college or prerequisites. Once you get out of school, it's totally different. What we look for in an employee as opposed to a candidate to a program are different. They're trying to find people who can succeed academically in their program. I'm looking for the best people to take care of those older patients that you're talking about. And that has almost zero to do with grade point average or anything like that. That has to do with the people skills that you've gathered your whole life.
So I'm sure you would, but would you recommend this career to someone that's looking into it.
I definitely would. This one, and I mean, any of the disciplines, and you'll see some of the therapists you talk to get kind of real protective of their own profession. They're like, I like physical therapy, but I don't like occupational therapy. But PT, OT, and speech are all great professions for people, and they're really good programs that they have at the university. I'm really proud of our local university, Arkansas State University, even though I went to the other university. I've got to know them really well. I know they try really hard to put out good students, but as far as the profession itself, absolutely, it's been very good to me. You'll consistently see that physical therapists are some of the most satisfied people in their jobs, and they're really, it makes my job easier as an administrator of them. They're all hardworking people who are dedicated, who are professionals. I don't have to, everything I do at my desk, it's not discipline. I don't have to get on to people and beg people to come to work. They all come to work. Never do I have to go say, hey, you took really sorry care of this patient. Let's see how you can get to become a better therapist. Never have to worry about that. So.
Awesome. Well, I think I've been interrogating you now. Thank you for letting me interview you. I've actually learned a lot about it.
Very good.